Those FDI levels may rise even higher thanks to Beijing's push for the public to buy private health insurance. China is aging fast. 15% of the total population was aged 60 or above in 2013. And the government has already created a vast medical insurance network built up in the last 2 decades. It has 3 components: the new rural cooperative medical scheme, the urban employees basic medical insurance, and the urban residents basic medical insurance meant for those that are unemployed. Now, participants pay part of their salaries towards medical insurance, while their employers and the government pay the rest. And 95% of the population is covered by these programs. But despite the extensive nature of its health insurance programs, the government is taking an extra step to make sure that everyone's health needs are met. And they're doing that by encouraging more of the country to buy commercial health insurance. CCTV's Xiaocen reports.
Consumers who spend more than 2,400 yuan on commercial health insurance policies per year will now only pay individual taxes on income above 3,700 yuan per month instead of 3,500 yuan. Individuals whose income is below the 3,500 yuan per month pay no tax in any case. The new policy is expected to encourage consumers to purchase individual health policies in addition to their standard government benefits.
I have been thinking about increasing the insurance premium I pay, and the new tax policy plan is making me consider it more seriously.
The cancer incidence rate is higher for women, so I would like to get supplementary insurance on top of the basic one. The new tax benefits make that a much more attractive option.
Consumers are increasingly concerned about health issues and have become more interested in buying private insurance. Last year, health insurance premiums collected in China grew 41% year-on-year to nearly 159 billion yuan. Still, there was only about 13% of all premiums spent on personal insurance in the country. Commercial insurers believe the government's pilot tax benefit plan offers a good opportunity for them to expand their business, but there are still some challenges.
Once consumers are interested, though, there are further challenges as a specialist health insurer for us to manage the cost of care that's provided to those consumers, and particularly to work with public hospitals to manage that cost of care. That's something where, at the moment, there are not deep relationships between providers of private health insurance and public providers of healthcare, and it's something we'll need to continue to work at.
As the private insurers work out how to cooperate with public healthcare providers, insurance professor Xiaocen from Fudan University believes that in the long run, private health insurance will play an important role in supplementing government-provided insurance.
The
government only pays for expenses covered by the basic medical insurance. The expenses that are not covered, such as serious diseases and special medications, will need to be covered by commercial health insurance.
However, Xu says the 2,400 yuan tax credit is low compared to that allowed in other countries, and so improvements will have to be made over time. Currently, just over 1% of total medical costs in China are paid by commercial health insurance. The figure is over 10% in Germany and France and reaches 37% in the US. Xiaocen, ICS for CCTV, Shanghai.